So you have chronic foot pain or plantar fasciitis that's just not getting better, and you tried multiple techniques from physical therapy, acupuncture, chiropractic, maybe you tried shockwave, you've got injected. I want to teach you a simple Qi Gong technique or protocol that'll help break up the adhesions around the foot and ankle, as well as increase blood flow and circulation down to the foot. Now, where we're going to start is this. If we look at our feet, there's a muscle connection from the toes that run up behind my calf and runs all the way up to basically behind my head. So we're not going to start at the feet. We're going to start releasing the fascia from the head all the way down. So the first spot I want you to start with is this. We're going to go behind the head and we're just going to rub this out. And as we're rubbing this out, you want to dig your fingers into this area. And then after this, we're going to start tapping a little bit just to increase more blood flow. And we're going to do this for about 60 seconds. And just work your way down into your neck. Releasing those adhesions and increasing blood flow. Perfect. Now from here, we're going to work our way down to our lower back. And now we're just following the myofascial line all the way down. And there are these ridges right through here. You want to dig your knuckles. So you want to make knuckles like this. And you want to dig it right into this area. And then we're going to work our way outwards. And we're going to come back. Work our way out. And then come back. Now from here, we're going to work our way down into the hamstring. So from here, and we're tapping up and down, increasing blood flow and circulation in that myofascial pathway. We want to spend a little bit more time behind the knee, because that's where the sciatic nerve could be a little bit compressed. It's called the tibial nerve. It runs through right behind the knee. So you want to free that up. And then I'm going to turn around. My head is probably really red by now. And you want to come right to the front part of your shins. Gentle fist, and you're going to hit the front part of your shin. This nerve goes right down to the front ankle. All right, and we're going to release this. And then from here, I'm going to turn my toes out just a little bit. And I'm going to hit this bone right through here. That's where the tibial nerve comes to the surface, because the tibial nerve goes right down to the foot. So whenever you have chronic plantar fasciitis, typically it's not in the foot. It's a scar tissue or a boundingness around the sciatic nerve that runs from here all the way down the back of your leg. And it can be compressed at a muscle called the piriformis, two ligaments in the butt called the sacrotuberous ligament and the dorsosacral ligaments, the hamstring, the popliteus, and then right through here, it can be compressed. And then it also gets compressed at the tarsal tunnel, which runs right through here, and then right down to the bottom of the foot. So we want to free up that nerve all the way down. So let's go back to here. Let's turn the toes out now, go back to here. And then the next one will be better in sitting. But what you want to do now is tap right between this bone and that bone and work your way to the foot. And this will be much better in sitting. Good. And what you're still noticing is tingling. And it's that tingling that's increasing blood flow and circulation. All right, so I'm going to review it again. So we want to start behind the head. Work these muscles. Spend about 60 seconds here. Go to the lower back. About 60 seconds here. Phoenix eye, these are called. Phoenix eye. Right to the sacrum or the SI joint. And then work your way out to the gluteus medius. And then we're going to tap the glutes, piriformis, down the hamstrings and back up for about 60 seconds. Spend a little bit more time behind the knee. Sorry, my butt is in your face. And then turn the toes out a little bit. Tap here And then turn the toes out a little bit more. You're tapping where the tibial nerve comes to the surface on the inside. Then you're going to tap right through here, tarsal tunnel, down to your foot. So every day, practice this technique. And we should notice over a week or two, the pain starts going away. Listen guys, I have a lot of videos on how to heal yourself naturally, either using nutritional therapy, peptide therapy, Qi Gong exercise, physical therapy, doesn't matter. But we have a whole entire channel that's dedicated to you. Please subscribe, like, comment. Let me know how you feel with these techniques. Sempre Devante, always forward.